Hi guys, thanks for tuning in to another episode of Nuggets News. In this video I want to cover another exciting project, and that's Health Nexus. Now these guys are creating a blockchain infrastructure or data marketplace to allow healthcare providers to safely share their patient data, reducing healthcare costs and reducing medical malpractice globally. Now you guys know that I'm a pharmacist by trade, and this is the second in a series of medical-based projects that I plan to cover. So the healthcare industry struggles to share data due to concerns about privacy, security, and the costs of aligning all these different tech infrastructures. Now, you know that you'll go to a doctor and they'll have a different system and database to the hospital versus an ambulance or the pharmacy, nursing homes, and it's all very fragmented. There's no real, continuation of patient care. Now, this results in slow, inaccurate, and costly processes that impact people's lives. So it's a great real-world problem they're trying to solve here. We've spoken about a number of projects that are using blockchain and the distributed ledger technology to help solve these issues. So the CEO, Kat, was a hospital administrator, and she saw this firsthand and was very frustrated in that she didn't know what happened to patients once they left the hospital. And I've seen that firsthand as well. We just don't know what happens when people are discharged, and that often leads to being readmitted, and that's very costly for hospitals and all healthcare providers. So the first product that SimplyVital Health, the company behind this project, rolled out was bundled payments. And I guess you think of this as a capped reimbursement from start to finish, all the different healthcare providers, and depending on the patient outcomes, you can either save money or you'll be hit with a financial penalty if you don't look after that patient to the best of your ability. So bundle programs already saving plenty of money. It's costing governments hundreds of billions of dollars. The first product was called Connecting Care. So it's already generating revenue within 7 months. We don't have exact numbers, but it's always good to see these projects that have a working product and are already rolled out in the real world. So the second product that SimplyVital Health are producing is this Health Nexus blockchain-based project that they're having an ICO for in the near future. So it's an Ethereum-based blockchain. I'll talk about that as well. So it's free and open source. Plenty of people will hopefully be building on top of this system, and the real key to the success is going to be onboarding the healthcare professionals and developers and those people that are going to be wanting to build those apps. So why not Bitcoin and Ethereum? Now, we've spoken about scaling issues that all projects are facing. So Health Nexus have done, they call it a fork, but it's very different to an actual hard fork, guys. So with these open source projects, anyone can take the Ethereum code base, and what they've done is they've tweaked it slightly so it's compliant with government laws and regulations. So the Health Information Portability and Accountability Act. So this is a globally recognized standard to allow for the sharing of healthcare data. And that is the main issue why we haven't had these projects and databases that are open in the public, because of all the privacy laws in different countries. Now, they have addressed this in the white paper that individual apps that are built on top of Health Nexus will have to comply with individuals' countries' laws. So they have thought about this, and it's great to see. So Health Nexus, healthcare grade blockchain. So inbuilt governance at the protocol level, the nodes that are validating all these transactions will also be compliant with those privacy laws, which is great to see. Now, that does lead to some degree of centralization, and we've spoken in a number of videos about the pros and cons and the trade-offs of having fully decentralized projects versus these slightly centralized projects, but we need that for all that privacy data. So nodes run alongside the blockchain to provide integrated access to encrypted data. Smart contracts will speak about that health cash token to enable cross-provider payments and manage all that data. But that token itself is going to be key to this ecosystem. So we've seen those platform-based projects, Ethereum and Neo, and once projects start building on top of them, it gives that blockchain a lot of intrinsic value. So if this is a successful project, that health cash token is going to be a pivotal part of this ecosystem. So open source, consortium governed, free rent, they really want to break down the barriers to entry to get people to use this. And it's a problem that all healthcare based projects are going to face, onboarding of health professionals. So Ethereum based protocol, I've described that already there, guys. SimplyVital Health, this is a good visual representation comparing themselves to Apple. So they have products that they sell, such as that first product they produced, Connecting Care. Now they've got their own protocol that they're working on, just like we have Apple, and then we have all the apps on the Apple Store. They're hoping that we'll have all these different healthcare apps being built by these developers. Anyone can contribute apps to that data marketplace, okay, and use that Health Nexus protocol. So the revenue will come from all those apps, as well as the other products that they've already got, such as Connecting Care. Hopefully we get plenty of people building on this, guys. So the business model. Now, there's a couple of things that they're working on next that can be built on top of Health Nexus. So key pair system for data sharing. Obviously, those smart contracts and all those privacy compliant distributed data storage. Now, we know the blockchains aren't capable of storing massive amounts of data, but we can use it for that sort of auditability and distribution. So I won't dive into this too much, guys. Have a look at this in more detail if you want, but we know that this is going to create a marketplace for healthcare providers, care coordination, easy development of apps. I've spoken about a lot of that already. So healthcare providers already supporting us. Now there's some big names here already using this technology. Athena Health is a $1 billion company, guys, listed on the NASDAQ. Already been huge interest, and they're, this project itself is less than 12 months old, while SimplyVital Health has been around for a few years. So the team's got plenty of experience in relevant fields, which we love seeing. So I'll let you read those at your leisure, but the team here, and I've watched a number of interviews with Kat and a few of the other team members, and good experience, well-rounded, but their shortcomings were addressed by the advisors they appointed. So they did acknowledge that there was some weaknesses. They're not the largest team of all time, so they have got a number of world-class advisors on board, including people in positions of power at hospitals and healthcare positions in government. So people in the right places, and that's what I really like to see, guys. So just here we've got some examples of competition and whatnot, but one thing that they really acknowledge here is they don't want these other projects to be competition. They really want to work together and get people to use that protocol. So how many projects are building and working on top of Ethereum? And that's where I really would love to see this going. All these different healthcare projects building apps, and they can still generate income and whatnot, but they're just using that Health Nexus protocol to allow for that interoperability. Now here's a real world example of, without that Connecting Care product versus with it, you might pick up an infection that would have otherwise not been identified. Hospital admission, guys, is just through the roof, the amount of money it costs just to have someone in hospital for one day. Now, if you can, recognize that early, that's a huge difference, guys. So you're going to save governments money, and they're going to like that. So how's this all connect? How's it all come together? We've spoken about these healthcare providers that can enter agreements between patients and end users, pharmaceutical industries. People are going to want this for surveys, data, research, drug companies. We've spoken about the Health Nexus being the fuel of this whole ecosystem, and then the applications for all those services that are built into that Health Nexus protocol. So a few more examples of how this is going to be, really great for all the different health professionals and governments globally. So clinical quality metrics, we call it in Australia quality use of medicines, and all these laws about how we can best spend the money and save in different areas. Transparency, we know blockchains bring that. Insurance payments and reimbursements, pharmaceutical tracking, so prescriptions again, valid in one state, not valid in the next. Data accessibility and sharing, digital infrastructure, and future apps. So I'll let you read that white paper. That is very detailed there, guys. So just some concerns or things to be aware of, guys, is this rolling out in a few different phases, and each phase is said to be a year. So to start off with, that health token is just an ERC20 token, and they're working on those keys. But it is going to be 2 years before they roll out their own blockchain that they have been talking about. So guys, this is certainly one that I think has real potential, but they might not realize that for a few years. So maybe don't expect returns as soon as other projects that are out there. So just something to be aware of. Again, read that white paper if you want more details on all the stages of that rollout. So how do I see this all coming together, guys? So I think the key to the success for this one is going to be onboarding health professionals, getting those developers building apps, as well as all the users being comfortable with sharing their data and being able to contribute to those researchers and all that sort of thing. So we have to make sure we're working with those government frameworks, privacy laws, and all those different issues that exist in different countries. So a fantastic project solving a real world problem. They've already got a working project. They're building the infrastructure to build even more apps. Open source, guys. I really like where this one's going with an experienced team. I'll put my link down below so you can register for the ICO. It is still open at the moment, guys, if that interests you. Other than that, I hope you've enjoyed this presentation. Please hit like, subscribe if you haven't already, share these videos around, and as always, thanks for tuning in, guys. Cheers.